Good afternoon, everyone. This is Dr. Val Ark, Chair of the Montgomery County Board of Commissioners. We are here today on Wednesday, August the 5th. This week is the 22nd week of Montgomery County fighting the pandemic of the coronavirus, and it is our 6th week in the green phase. Today, I'll be joined by Montgomery County Commissioner Ken Lawrence and District Attorney Kevin Steele. So I'm going to deviate from my normal order today to give an update on Tropical Storm Isaias. After making landfall in North Carolina late Monday night, Tropical Storm Isaias made its way up the eastern seaboard of the United States, leaving behind a wide trail of destruction. Early yesterday morning, we began to feel the effects of this devastating storm here in Montgomery County. First to arrive was the torrential rain, which resulted in both severe flash flooding on our roadways and significant riverine flooding in our creeks and streams. Our emergency responders performed 134 water rescues across the county, pulling stranded commuters from their vehicles and ferrying residents from their homes. The Perkiomen Creek rose to levels not seen in more than 106 years, while a rainfall total of more than 8.5 inches was measured in Lower Marion Township. Around midday, strong winds joined the rain, toppling hundreds of trees and pulling down numerous utility lines. At the height of the storm, we had more than 64,000 homes and businesses out of power in Montgomery County. Approximately 10,500 customers remain without power. A maximum wind gust of 50 miles per hour was clocked at 1:35 p.m. yesterday at the PA 309 I-276 interchange in Upper Dublin Township. In addition, the National Weather Service has placed 2 separate areas in Montgomery County under investigation for possible tornado activity. Very tragically, we learned this morning that the storm claimed the life of Eliza Talal, a 5-year-old girl in Towamencin Township. I would like to extend my deepest condolences to her family and friends. In addition, ground, water, and air-based crews spent many hours yesterday searching the Schuylkill River in Montgomery and Philadelphia counties for a subject in the river. At this moment, we have no reports that this individual has been successfully located. Our Montgomery County 911 call center answered 5,097 calls for assistance yesterday, which is more than double a typical day's total of nearly 2,300. In fact, our telecommunicators fielded the daily average of calls in just a 4-hour period between 11 a.m. and 3 p.m. I would like to thank our dedicated 911 telecommunicator staff, as well as all of the Montgomery County first responders who keep us safe both yesterday and every day. If you suffered damage from the storm, please be sure to contact your insurance company, take pictures and document everything, and notify your township or borough, even if you do have insurance, so that we can get an overall picture of the extent of damages and possibly connect you with resources to help. The county declaration, which will enable us to collect any potential subsequent reimbursement for storm-related response and damage. So once again, thank you to everyone who helped all day yesterday, all night last night, because the floodwaters actually continued to rise overnight. We are so grateful for your service and for helping to keep our community safe. So with that, I will move on to my normal COVID update. Since the August 4th press release, we have 44 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 9,517. These positive cases are a result of a positive test for the virus, not from the antibody test. Of the cases today, 4 are from the Montgomery County Correctional Facility, none are from a long-term care facility, and 40 are from the community. Of these 40 tests from the community, 13 tests were conducted between July 20th and July 27th. The remainder of these tests, 31, were conducted between July 30th and August the 4th. These positive individuals are from 17 municipalities. We remain at 61 of 62 Montgomery County municipalities home to individuals with COVID-19. These individuals range in age from 5 months old to 86 years old. As always, you can check the county map found at www.makopa.org/COVID-19 for updated geographic information. Today, we have 22 females and 22 males. I am also sorry to confirm that 1 Montgomery County resident has lost their life to COVID-19, which brings us to 820 confirmed positive from COVID-19. This individual died in a hospital and was 86 years old. In total, 440 females and 381 males have lost their lives to the coronavirus. The racial breakdown as we have it, we have 18 individuals that identified as Asian, 3 Asian Indian, 3 Asian Korean, 100 African American or Black, 323 white, and 374 unknown. In terms of hospital beds, today the number of hospitalized COVID-19 patients is up to approximately 70. We had been running in the mid-50s for a couple of weeks, so this does represent a modest increase. However, the number of individuals requiring a ventilator is down to 8, or approximately 12%. So we have seen an improvement or decrease in ventilator use, but somewhat of an increase in overall hospital bed utilization. I do have an update from the Montgomery County Correctional Facility today. Since June the 25th, the correctional facility has been consistently seeing about 18% of individuals booked into the correctional facility testing positive for COVID-19. These individuals contracted the coronavirus prior to entering the correctional facility. All new commits undergo testing and a quarantine process as part of their intake. And all of these positive individuals are in isolation and currently stable. Additionally, since Sunday, 6 inmates in the general population have tested positive for COVID-19. These individuals are in isolation and their cellmates and housing units are in quarantine. All are currently stable. As a reminder, since the President Judge issued the initial March 12th, 2020 order declaring a judicial emergency, the population in the Montgomery County Correctional Facility has gone from 1,342 to 841 today, a net decrease of 501 individuals, which is a 37% decrease. Since March the 13th, there have been a total of 1,631 discharges. On to community testing. The county, as you know, now has 6 COVID-19 sites up and running around the county. None of these sites require a car to be tested. The sites do require an appointment. All appointments are made on the day of testing, beginning at 8:30 in the morning. You cannot book ahead. We do require that the person being tested is a resident of Montgomery County or works in Montgomery County. These county-run sites provide testing at no cost, though insurance will be billed if you have it. They do not require a healthcare provider's order, and we will test individuals of any age who want or need to be tested. The cost of these sites is being covered by CARES Act funding that has been allocated directly to Montgomery County. As a reminder, these sites are located in Pottstown, Lansdale, Willow Grove, Green Lane, Ardmore, and Norristown. To register for a test or look at the hours or find out the addresses, you can go online at www.moncopa.org/COVID-19 and click on the green County Testing Information button. And again, as a reminder, appointments become available at 8:30 in the morning on Monday through Friday. Now, we also can take registration by phone. And to make an appointment by phone, you can call 610-970-2937. Again, starting at 8:30 in the morning on the day that you would like to be tested. Spanish-speaking operators, as well as language line translators, are available by phone. So we continue to do well here in the county, working together. We have been able to dramatically reduce the spread of the coronavirus in Montgomery County. But again, this is no time to let up. This virus is by no means gone. So we just need to stay the course. So we'll go through our weekly graphs here to show you how we are doing. And we'll start with our date of test graph. And as a reminder, this graph shows you the total number of individuals that have tested positive on any particular day, and those are the gray vertical bars in the background. And then the various lines show you where those positive tests came from. So the red lines, the pink and darker red, are the total number of tests, the 7-day and 14-day average. The blue lines are the tests from the community, and the yellow lines are the tests from long-term care facilities, again, 7 and 14-day averages. So I just have to point out that the long-term care facilities numbers are down so low that they are many days at 0. So as a consequence of that, the total case numbers and the community case number lines have basically converged. So you can see that we've been holding steady. I think we have a Zoom in coming up next. Their sense of how we're doing in the last 30 days. And these results are current as of July the 31st. With the current testing lag that we're experiencing, showing you tests any more recently than that doesn't give a very accurate picture of how we're doing. So you can see that we're holding pretty steady with very low numbers. So next we'll move on to the positivity graph. And again, this is as of July the 31st. And as a reminder, the orange, very jaggedy line represents the number of PCR tests performed on any resident of Montgomery County on that day. So it doesn't matter where they got their tests done. This is our attempt to get a measure of the total number of tests that were conducted on any Montgomery County resident. And you can see that, slowly over time, the total number of tests is going up, which is great. And even better, our positivity rate continues to stay basically stable, or actually today it's down a little bit. We are now down as of July 31st to 3.17%. So that is fantastic news, and certainly where we want to be and keep this virus suppressed. So what can you do to help maintain these numbers? Number one, don't leave home without a mask. Put it on whenever you are within 6 feet of someone who is not in your household. Put your mask with your car keys in your wallet. Do not leave home without it, even if you're just going for a walk in your neighborhood. You never know when you're going to run into a neighbor, and it's good to have that mask or face covering to put on when you stop to talk with them. Keep 6 feet distant from anyone who does not live in your household. Keep your hands clean and away if you need to or want to. And if you do test positive, please cooperate with contact tracing. I cannot stress enough how important it is to cooperate with our contact tracers. These conversations are confidential, they're non-judgmental. I'm very happy to share with you that we have seen a big improvement in cooperation with contact tracers. Right now, we're seeing that 96% of the individuals who are contacted by our teams are cooperating with contact tracing. I really thank you for that. That is a big part of how we are keeping these numbers so low, and we just want to make sure to keep that up. I also want to emphasize again why it's so important that if you do test positive, that you do your best to share the names of any people that you might have come in contact with during the time that you were positive and or could have been infectious, and then now that you know that you're positive. And a lot of people want to just tell the individuals themselves. But I wanted to share with you why it's so important that you actually let this process run out as it's supposed to. So when our contact tracers call anyone that you've been in direct contact with, first of all, they don't say who it was that they may have been exposed to. So that piece of information is kept confidential. Secondly, they inform them of their requirement to quarantine due to exposure. Contact tracers are able to answer any questions that the individual has about COVID-19 or refer them for additional guidance. They can talk to them about how to get tested if they'd like to be tested. Contact tracers ask if the individual is able to safely quarantine in their home. If not, no-cost alternatives are provided. Additional supports can be arranged, such as help with needs. It's absolutely critical to the suppression of the coronavirus in our region that everybody cooperates with contact tracing. And again, as a reminder, if you're called, your phone might show any of the following. The caller ID could say ACLAMO. It could say Visiting Nurses Association, or VNA. It might come up as Family Services of Montgomery County, or it could come up as Montgomery County OIC. It's also possible that depending upon who's calling you and which line it's from, it might come up as unknown. So I know none of us really like to answer those unknown phone calls, but if you're at all concerned that maybe you have been exposed and you see unknown pop up on your phone, please pick up that phone. Okay, what we continue to learn from our contact tracing is where we might have concerns about outbreaks. We find out where people work, where they've been out to dinner or other places like that. So we learn a lot from this contact tracing. And I will share with you, as I did last week, that we're seeing our primary areas of concern in two places. One are youth sports and athletic teams, and the other is private social gatherings. So again, just please be very mindful if you are engaged in either one of these activities. We have several sports teams now where the entire team is out on quarantine. It is very hard for transmission to be avoided in settings where people are close together and not wearing masks. We just know how contagious this virus is, and that's how it spreads. The other area is social gatherings. And again, I think people are trying to do this right. Absolutely, outdoors is safer than indoors, but it is so important that you keep a mask on. So important that you keep that 6 feet of distance from any. And if you've had a drink or two, you might have to remind yourself again about that 6 feet of distance and, really stay focused on the fact that this virus can spread very, very easily. And one final reminder about wearing masks. Again, our small business owners continue to reach out to us to ask you to please help them. And you can help them in a couple ways. One, by shopping at that business or utilizing that small business. And two, when you're there, to please wear a mask. These small business owners are doing everything they can to comply with existing orders, including they're wearing a mask all day themselves. Remember that these businesses are at risk of losing their licenses for non-compliance. So unless you have a specific condition which would prevent you from wearing a mask, please respect these businesses. They're just starting to get back on their feet and wear a mask. And I have one more announcement today, which is about the 2020 census. We've been talking about this census for months now, and I want to thank the Montgomery County residents who've already responded. As of this week, we are at 74%, which is great. 10 years ago, we only got to 75%. So we have some time to go, but not as much as we thought we had. So we can definitely blow through that 75%, but we need to get as close to 100% as we can. For those of you that have not yet responded, this request has taken on some new urgency. We found out this week that the census has changed their deadlines again, and they've actually made them earlier. So the new deadline is to submit all responses by September the 30th. This is less than 60 days away. I also want you to know, starting to knock on doors. So if you would prefer not to have somebody knock on your door, the simplest way to avoid that is to just complete the census. So let me tell you how you can do that. If you have lost your paperwork, you should have gotten paperwork, but if you lost it or you never saw it, then you can go online at my2020census.gov. That's my 2020, the numbers 2020, census.gov. And the online response form is available in over a dozen languages. You can also respond by phone. In English, you would call 844-330-2020. To respond in Spanish, you can call 844-468-2020. There are telephone display devices for the hearing impaired by calling 844-467-2020. And there are many more languages available by visiting census.gov and searching on responding by phone. And there you can see a list of many, many languages that you can choose from in order to respond. Now, why do I keep bothering you about this? Because this is critically important for the next 10 years of Montgomery County. I want to remind you that if only 5%, just 5% of households don't respond, we're only at 74% now. So even if we get up to 95% of our households responding, we can lose around $72 million annually in funding for Montgomery County schools, aid, SNAP, housing choice vouchers, Head Start, senior programs, and more. That's $72 million a year for the next 10 years. Folks, the stakes really could not be higher. This is funding that we deserve here in Montgomery County based on the number of people who live here. If we don't count ourselves accurately, all that means is that some other place will get more than they should. So let's make sure that we count every person in Montgomery County. Make your future count. This is one really great and simple and quick way to do it. And with that, I will turn over to Commissioner Ken Lawrence.
Good afternoon. Today I'm going to share information about 3 programs to help small business owners and then renters and homeowners. The PA Community Development Financial Institutions Program, CDFI network, has announced that the second grant application window for the COVID-19 Relief PA Statewide Small Business Assistance Program will open at 9 a.m. on August 10th. It will remain open for 15 business days, closing at 11:59 p.m. on August 28th. Small business owners may learn more about the program and apply at www.pabusinessgrants.com. Please note that in order to get funds to businesses in need as quickly as possible, this second application window will be the final opportunity to apply for the program. Previously, the intent was to have 4 application windows. If a business applied during the first application window, They should receive notification of their application status by August 10th from the CDFI network. Applicants from the first round do not need to reapply again. Qualified applicants will automatically be rolled over into the next funding round for consideration. So if you're a small business owner, or if you know a small business owner in need of assistance, please go to www.pabusinessgrants.com so you can apply for this statewide opportunity. The second program I'm going to speak about is for homeowners. Montgomery County residents in need of emergency mortgage assistance can apply directly to the PHFA by visiting www.phfa.org/PACares. Homeowners may receive up to $1,000 a month for a maximum period of 6 months for the time period between March 1st and December 30th, 2020. Applications are available and can be accessed by clicking on the REDS CARES banner on the Pennsylvania Housing Finance Agency's website at www.phafa.org. The agency's toll-free call center is 1-855-YOU-ARE-HOME, which is also 1-855-827-3466. They are available weekdays from 8 a.m. to 5 p.m. to assist the public and help with questions about the programs. Callers should listen for the prompts mentioning CARES assistance for renters and homeowners. And the final program is for renters. Our Montgomery County Health and Human Services has partnered with the Pennsylvania Housing Finance Agency, PHFA, to offer a rent relief program for low and moderate income renters during the COVID-19 pandemic. Applications open on Monday, July 6th and will be accepted until September 30th, 2020. Payments of up to $750 per month are available for those who qualify for a maximum of 6 months between the time period of March 1st and December 30th, 2020. Funding is provided by the PHFA through the Federal Coronavirus Aid, Relief, and Economic Security Act, also known as CARES, which is appropriated at least $150 million for rent relief. Applicants must be Montgomery County residents and have lost more than 30% of their income due to reduced work hours or wages, or have become unemployed after March 1st. Renters' income before March 1st must be no more than 100% of the area median income, or $96,600 for a family of 4. An income table for the program is available at www.montcopa.org/HHS and by clicking on the RRP logo at the top of the page. You can also find more information by calling one of our community navigates. You can call 610-278-3929. So if you are a renter or a homeowner in need of assistance, please take advantage of these programs. And with that, I'm going to turn it over to our district attorney, Kevin Steele.
Thank you, Commissioner Lawrence. Thanks for having me here today. Sadly, I'm here to talk with you this afternoon about a number of recent murders that we've had in Montgomery County. Last week, a young woman, just 18 years old, was stabbed to death by her former boyfriend at a train station in Abington after she agreed to meet with him to talk. 2 days earlier, on July 25th, a husband was arguing with his wife, shot her in the leg, and then when she called 911, he fired more shots and killed both his wife and his mother-in-law. If that's not tragic enough, 2 children were in the home at the times of those murders. Now, back in mid-April, we had 2 more homicides. A 79-year-old man used an electrical cord to strangle his wife to death. And a couple in their 20s who lived together were arguing. She grabbed a knife and stabbed her significant other to death. These are not random acts of violence or murders that are being fueled by drug trafficking or some other crime. These are murders that are relationship violence or domestic violence in nature. And the fact that all of our homicides since this pandemic have begun have been domestic violence or relationship violence is a disturbing trend, and it's why I appreciate being here with you all today. Early on in this pandemic, we looked at our 911 calls classified as domestic calls, and at the subsequent police reports following that contact. Our analysts in the Montgomery County Detective Bureau looked at the same data for mid-March to mid-April in 2019, and then that same period for 2020. And what they found were that calls for help from police were up by about 9%. And we suspect that that trend has continued and maybe even higher, since both agencies in Montgomery County that help domestic violence victims are reporting increased contacts for assistance, especially through police referrals. The increase in 911 calls and police incident reports related to domestic violence means the victims need help, and that victims are calling when they are able to. And even more important is the fact that help is still available. During this coronavirus crisis, staying at home or following the current recommendations to continue to limit trips and stay inside your pandemic bubble is designed to keep us all safe from the virus. But in 3 of these homicides, and in other cases where domestic violence is present, staying at home can be a dangerous situation. Living in these unprecedented pandemic is stressful, with the adults and children staying at home together, often confined to close quarters, while at the same time being upended from their routines, friends, jobs, and other constants in their lives. Add to that, the fears of getting coronavirus, experience a job loss or a layoff, and other stressors. And you have a situation that can lead to tensions in even the best of relationships, but especially where there's a family member who is physically or emotionally abusive. And I want to emphasize this, that there is help. Police in Montgomery County are always available by calling 911. And other agencies, such as Laurel House and the Women's Center in Montgomery County, are still helping victims, and with and through their services that range from safe housing to advice from trained counselors, through their hotlines to help with obtaining protection from abuse orders. Both Laurel House and the Women's Center domestic violence hotlines are answered 24 hours a day, 7 days a week. Those numbers for Laurel House is 800-642-3150. Again, 800-642-3150 is the hotline for Laurel House. For the Women's Center of Mako, it's 800-773-2424. Again, 800-773-2424. So if you are a victim and don't feel that you can call because of your situation being at home, you can look on their websites for helpful information about staying safe, or for help in making a plan to leave your abuser. The websites for Laurel House and the Women's Center are laurel-house.com and wcmontgo.com for the Women's Center. And we really stress for people to try to have a plan or reach out for help if they think they can do so safely, and if neighbors or other people see things, we ask that people reach out for help in these unprecedented times. Now, I'd be remiss if I didn't talk a little bit about the most recent homicide, where Morgan McCaffrey, just 18 years old, and a new high school graduate, was killed by a former boyfriend. Now, that is not domestic violence, but it's a close cousin. It's called relationship violence. And relationship violence is when a murderer and a victim who don't live together but are in some kind of prior relationship or in a current relationship when the violence or murder occurs. Now, I don't know all the details of what led up to this tragic murder, but what I do know is that our children, our college students, our high schoolers, our middle schoolers need to know what constitutes a healthy dating relationship and what signifies an unhealthy dating relationship. And they need to know how to spot these warning signs or red flags in a dating relationship, early on. And to that end, we offer free presentations in schools in Montgomery County on relationship violence, on healthy dating relationships, assistant district attorneys from our family protection unit. And these are folks that are specially trained in this, can and have done these presentations over Zoom to college and high school audience. And look, the price is right. It's free to schools or colleges in Montgomery County, and it provides important information that our daughters and our sons need to know. The presentation about dating and relationship violence is just one presentation that our office does for free for schools in our county as part of our educational outreach efforts. And usually they're done through a school assembly. But as I said, we are adapting them to a Zoom platform, and any school administrator, principal, counselor can call our office. And our main office line is 610-278-3090, 278-3090, and ask for more information on these presentations. We hope and pray that through education to our young people and outreach through these wonderful agencies like Laurel House and the Women's Center, that hopefully we can reach everyone who needs help and get them the help that they need before it's too late. I appreciate having this time, commissioners, and you allowing me to participate in the briefing as we try to prevent some of these things that we've seen from happening. Please stay healthy and safe.
Thank you, District Attorney Steele and Commissioner Lawrence. And also just one additional reminder, if you are in a situation where you don't think it's safe to call 911 by a voice call, here in Montgomery County, as long as your phone is connected to a Montgomery County cell phone tower, you can text 911. So our telecommunicators will respond just as quickly and are completely set up to carry out a conversation with you by text message. So you don't even, you can text us, and we will send help as quickly as possible. So District Attorney, thank you so much for raising up this important issue. We talked about this in the early days of the pandemic and our concerns about mental health challenges and domestic violence challenges, child abuse challenges, all things that unfortunately remain with us in addition to this virus. So we really appreciate your time today and all the good work that you're doing to combat these issues. So with that, I will announce that our next briefing will be Wednesday, August the 12th at 3 p.m. And I will be happy to take any questions.
Thanks, Commissioner. This afternoon, we're joined by Carl Hessler from the Pottstown Mercury.
Good afternoon, Dr. Arkush. You were speaking, let's first take some questions on the tropical storm damage. You mentioned that there were 2 areas being reviewed for possible tornadic activity. Can you be more specific? What areas are they looking at?
I don't have the specific details on that. Apparently, there are 2 fairly long lines of potential activity that cross multiple townships. So I don't have a good answer for that yet.
Okay. And then there was a little voice interference at one point where you were speaking. Did you say that the county has declared a disaster emergency or was considering it? Did you say
we did declare one earlier today.
Okay, and what steps does that now allow to occur? What is the importance of declaring a disaster emergency?
The importance of the declaration of a disaster emergency from the county will allow us to collect data from all of our on any damage. Typically, we would ask that person to report it to their township, and then the township will report it to us. And should the federal government or the governor declare a state of emergency in our region from this storm, then that gives us the legal mechanism to request reimbursement, both for the response that the county had, which you heard was quite extensive, as well as for individual property owners who've had property damaged.
Okay. On to the virus data. There are some surrounding counties who have higher positivity rates than Montgomery County right now. And how concerning is that to you? And should Montgomery County residents be concerned about traveling between all of these different counties? A lot of people travel from Montgomery County to other counties to work, to visit friends. Do you have any kind of message about that subject?
Mm-hmm. Well, I would remind everybody that you're still safer at home. So if you are able to work from home, then that's great, and you should continue to do so if that's possible. I've also said many, many times, we are all in this together, and this virus doesn't care about boundaries of counties or cities or townships, and we do need to always be mindful of that. So, if someone cannot work from home and needs to go to work, obviously that's important, and they should continue to do that. And hopefully their workplace is being made as safe as possible. But if you don't have to go somewhere, think twice about going. We are seeing in some of our surrounding rates than we're experiencing right now in Montgomery County. And so if you can avoid that trip or maybe skip a social gathering, just think twice. But if you do go, what's so critically important is you follow the guidelines of wearing a mask and staying 6 feet away from people that aren't in your household. And that holds whether you're indoors or outdoors. Outdoors is always safer than indoors. But even outdoors, you should just keep that mask on. That will go the furthest to keeping you the safest. So I think just, some common sense, continuing to remember that it's safer to be at home if that's possible in your particular circumstances. And, just think twice before you go.
Okay, thank you. That's all I have today.
Thank you.
Thanks, Carl. Now we'll move on to Teresa with some questions from reporters who couldn't be with us here today.
Yes, 2 questions from Jim Milward at KYW. The first one is, have you had any conversations with the governor or the Department of Health about using Mako Medical to expand testing and speed up results?
Not sure if Mr. Melward's asking maybe to other areas of the state. I have not. We've just been talking with them about our needs here in Montgomery County, as well as at our Montgomery County Correctional Facility, but have not talked to others about them expanding their services. The Department of Health is aware that we are switching over to Mako because we have to make sure that the proper interfaces are in place so that Mako can report their results to the state's database. And that's actually one of the things we're waiting on before we start using them for our testing, but have only talked to them about our needs here in Montgomery County.
Okay, the second question is, are there any specific numbers or more specific information on youth sports positive cases?
I touched on that a little bit earlier, and I realized Mr. Melward wasn't here, but we do continue to see spread in youth sports teams. And we've had, there have been several now that have had to go out on quarantine. So again, this is another one of those, just think twice about this. If it's makes sense for your family to have a child participate in youth sports or not. We are seeing spread there, and we offer that as just guidance to the community so people are aware to help them do their individual risk assessment as they make the best decisions as they can for their families.
Mr. Milward did follow up on the first question, saying that he was asking about the state using the Mako medical tests.
Yeah, I have not been involved in any conversations like that.
Okay. Do we have any more specific numbers other than several cases regarding the youth sports positive cases?
I don't have those in front of me.
Those are all the questions that I have.
Okay. All right. So is that it, Todd?
Yes, there are no further questions.
Okay, great. Well, thank you, everyone. Stay safe and stay well, and we will see you next week, and keep up the good work.